American Natividad in Scarborough. You may have heard the term twin-demic. It's being used to describe the potentially dangerous overlap of a severe flu season with the second wave of COVID-19 on our healthcare system. Well, in order to avoid this, health officials have been urging everyone to get a flu shot. The problem is that has caused a surge in demand, and pharmacies and clinics are having trouble keeping up. If you're trying to get a flu shot at your local pharmacy, you may have seen a sign like this. You're not alone.
Our own little pharmacy that we get our meds from, they don't have it. The medicine shop that's close to us, they don't have it. Our doctor's office doesn't have it.
The demand this year has been particularly remarkable. It's been through the roof.
We've been doing the flu shots for about 8 years at my stores, and I've never seen anything like this.
Pharmacists believe the rise in demand is also partially due to the pandemic spurring some who don't usually get the flu shot to take it more seriously. Such was the case for Ingrid Bauer, who got hers today.
I know I needed one this year, more so than ever because of the pandemic.
The Public Health Agency of Canada says more than 13 million doses have been ordered this season. That's nearly 2 million more than last year. Those doses include a higher proportion of high-dose vaccines for seniors, who account for most hospitalizations and deaths from the flu and from COVID-19. So why are several locations already out?
We've been told that there should be enough vaccines for the entire population this season. However, because of this immediate surge in demand, there has been a rush on supply. Nevertheless, we are reordering very frequently and hopefully getting replenished soon.
In a statement, a spokesperson for Ontario's Ministry of Health said the first shipments of flu vaccines started being delivered to public health units, long-term care homes, and hospitals to prioritize vulnerable populations. Broader community distribution of the flu shot, including 2 primary care providers and pharmacies, is currently being rolled out and will continue in the coming weeks. A spokesperson for McKesson Canada, which owns Rexall Pharmacies, says they're confident in the supply outlook, saying their pharmacies will be receiving larger shipments within the next 2 weeks. As for Shoppers Drug Mart, flu vaccines have already been made available in Ontario, PEI, and New Brunswick. They are still waiting for confirmed dates for BC, Manitoba, and Quebec. Saskatchewan will begin vaccinations on October 13th, while Nova Scotia and Alberta will begin on October 19th.
All I say to the people is just be a little bit patient right now. I know it's difficult times and everybody wants to get a flu shot, but I'm sure we're going to get some more soon, and just be patient.
Now, with Shoppers specifically, you can actually go online to fill out the paperwork ahead of time, and you're supposed to be able to see which locations have flu shots available. But multiple viewers have reached out to us telling us that when they go to these locations, that they're already out. A spokesperson for Loblaws, who owns the chain, says that this is again due to a surge in demand, and they're just going so quickly. So the best thing to do all around is, whether you're going to a pharmacy or a clinic, just call ahead of time to make sure that there are flu shots available. But again, a lot of people are just unhappy that there are already these sort of surge of shortages so early in the season.